I guess so. The voice is clear, so we're going to start the session. And this is your mentor, Dr. Sherry. We're going to solve our rheumatology today. Some recalls and some important recalls are going to come up. I hope so. The screen is visible and the screen is looking great. I hope so. So let's go and start the session without any further delay. And make sure your video and audio is turned off just to make the class more easy. I'll be also turning myself off in a few seconds. And let's go and start the session. Before every session start, I give few tips to all the dear doctors actually. I hope so those tips are useful and you'll try to remember and follow them at the same time. All right, so let's go without any further delay. Let's go and do that session actually. Yeah. All right, so as you can see in the screen, and I think the voice is clear. So for better preparation, uh, last Friday one doctor called, and I'll just try to convey that information. I think many of you also have the same, thing in mind, how to take a better preparation, right? If you are agreed, then please respond with a yes. That are you looking forward to know how to take a much better preparation in coming days? Because the syllabus is not that easy and small. And we have finished 1 month of class. And it's high time to tell you guys that how to take a much better preparation, because initial few days, guys, it's very normal that you need to look forward how the system works. You need to get adjusted with the system. Afterwards, you will increase your speed. If you have ever noticed any 100-meter sprint, how many of you know Usain Bolt? How many, please respond with a like yes, me, or how many of you know Usain Bolt, the famous, the runner by of 100-meter actually. So if you have ever noticed, how they take the 100-meter, or if you have taken participant in your school, do we increase the speed in the beginning, or the gradually increase, we need to increase the speed, and at the end the best speed we need to give actually? What do you think? And the end, it should be, we should try the best at the end. So, initially it's slow. Gradually, you need to increase your speed so that you don't make sure that, others are not going forward to you actually. So you have to maintain the balance with others, correct? That's the thing. We definitely need to make a balance with the others actually, when we are taking the race actually. So a gradual speed so that you don't make mistake in the beginning, right? Many times if you have followed 100-meter in the beginning, some people messed up actually. All right, so you don't want that thing to happen. So initially a slow speed, that's fine, but gradually you need to speed up. That's most important. And make sure you also take the same speed with your participants actually. The same thing goes here. It's a competitive exam, so you need to follow the pace, so you need to catch up others at the same time. So this is that time actually. And at the end actually, you have to give your best in increase your highest speed. I will tell you what to do that time actually to increase the maximum speed. But that comes with not 5 hours study. The first basic is to increase your study hours at the end. Okay, so that's at the end tip. But end tips, we're not getting into today. We are going to the middle part tips actually, the maintenance dose actually in our doctoral language actually we're going to give now. So how to take a better preparation. So in terms of taking the better preparation, is if you guys can see some do and don'ts actually. Try to come up with a little animation. It keeps in your mind. You can take this one as a screenshot so that later you can follow. Like example, first don't. This is the, some of the experience which I'm sharing. I have 10 years of teaching experience. Also, in many of the awards, when I was in med school and in abroad, I've owned some of the awards actually for teaching techniques and the thing, because I used to do a lot of research on the students actually. And I also do a lot of research on you guys as well actually. So you can trust me on that one, especially in terms of the techniques and the things actually. That's very important in terms of passing and the things. Now the thing is here, I have seen one thing. Rather than those study alone, totally alone, and not like to interact, not like to do little group study, they either do bad in the exam or either it takes more time for them to appear in the exam. So there's two things. One, either it will take more time or either, I mean, they might fail in the exam. So this is the thing. And those in the group study always, appear in the exam more faster than them and the higher chances of passing. All right. I'm telling in terms of the AMC, PLAB, many of the medical students I deal, many of the post-graduation study students which I deal, because I'm also course coordinator of ICDDR. We also run some kind of post-graduation course here, like the diploma. So I have also monitored them at the same time. Yeah. So, I mean, so this is the thing. I mean, we need to keep it in mind actually. Like now, second point, I mean, which it comes in terms of our classes actually, because in the social media, we try to make things easy for you, but sometimes making things too easy, there is a word laziness that comes up. Over recording dependency. Now, this is a part you need to be really careful. I mean, in past, when I was not used to give any kind of recording, the student, also used to pass actually. And I figured out they were appearing in exam in more early because they have to make their own things in class. They have to be more alert and the things. But as time progresses, a lot of things we have to compromise. First of all, I'm not in that favor of always, just following recording. I know it's easy, but it makes you lazy at the same time. Okay, I mean, no one wants to answer here, but because they might thought like, okay, recall Dr. Sherry will take up. No, I'm not going to do that. But the thing is, this is like harsh truth actually. Over dependency on recording, that might be a very bad thing for getting the success in quick session actually. Avoiding forum. Now this is increasing nowadays. I mean, our results were very good when we were in the MC exam. I got very good marks. Some of my early days students, they used to got very high marks actually. Now they were extremely active in different forum, which I saw none of you are using. I mean, many of you are not using even secret group. I mean, that's very, I mean, bad actually, I would say. Like secret group, everyone is using, and of course, guideline group, Amedix group, these groups are using. This group still hasn't started yet. So I will believe maybe you guys are new, but please make sure that you guys are really, really, give your best in the forum. And don't think this bullshit thing that okay, what if I upload a question, what my friend will think. This is the most biggest bullshit. You definitely want to be a doctor in Australia. So why to hide it actually? And when you will be a doctor, then still you don't actually interact with people actually. So it doesn't matter. So do not hide yourself. Be the type, A personality. Be the type A personality, not B or C. All right. That's the thing. All right, so this is one of the things which I want to know. So avoiding forum, that's not a good news actually. Missing my exams. Now there's another group. They just like taking my classes. Here's also few doctors are there. They have been taking, because we made it very reasonable. I mean, courses are reasonable. Even retake, the course is also just like $50. So everyone can afford. It's very, I mean, reasonable. So there are some groups, they keep taking classes actually. Now it's not, it's good, it's okay, like, but thing is, you need to make a plan. All right. So and this can be effective if you take exams seriously actually. So they just keep taking classes. There's a one group, they said, okay, I have a kid, doctor, you should consider. Okay, considered. Next batch is still considered, third batch is still considered actually. So see, problem will be there always in the life. What do you think? Till we were in the school days, the problem has increased more in these days, or problem has, started solved. What do you think? I mean, as the time progresses, as the life progresses, what do you think? The problem increases or problem decreases? What do you think? I personally feel that, more responsibility and more problem that increases as the time progresses. So better to finish the problem when you're dealing with it actually, rather than not more than 1 year, you are just keep solving. I mean, just study, 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 better to finish it in 6, 7, or 8 months. Okay, just my tips actually. Okay, no plans. Sometimes some people call, and the very straightforward next question I ask after initial greetings, like, when is your exam? When you're planning? So, doctor, I don't know actually. Why you don't know actually? Okay, you should have a plan. Then I can guide you on that one. I'm not the one to tell you when to take the exam, but I can guide you. If you are planning in between, say, example, this batch is going to finish on August. So your date should be, planning should be September, October, or the November. If you're finishing in August, September is best time to revise actually, and then get into the exam in October. Maximum it can be November actually. All right. So those of you who are enthusiastic, studying well, along with me. So you should focus on that one, and you should finish the exam next year. How many of you want to finish the exam this current year? Please respond in the, and when you are planning. So let's just hear what's your plan. I mean, please comment, like if you haven't taken the exam date, that's fine, but when you are planning, so at least you can respond in the comment section. That's the thing. I mean, new doctors, I mean, when you are planning for the exam, you should have a plan. I mean, that's most important. Yes, no, inshallah, this year is not the, I mean, ideal. I mean, you should say a month. Okay, maybe this month. When you actually focus a month, it can be plus minus 1 month. You got my point? When you focus on one particular month, it should be plus minus 1 month. Okay. I'm talking about the new batch doctor. So if someone is answering June, I mean, think that, they are from the previous batch. All right. So those are telling before, I mean, August. I mean, it's definitely from not from this batch. Okay, so November is fine, October is fine, totally fine with me. Okay, now one more information. I mean, see, lack of information, doctor, like November, December, there is no MC exam. Okay, let me clear to all the dear doctor, December, January, there is no exam. So just to be clear that, why I said November, you need to finish. Okay, I hope so. New information we just learned today. All right, one more information. Mobile phone for class, one step towards failing. I don't have any blessing for them, first of all. Like those use mobile device in spite of telling again and again. So, I mean, you are doing injustice to, yes, one emergency, it's a different thing. Now, another doctor, I don't have a laptop. Congratulations, you know what to say for this kind of people. You don't have a laptop, please get a laptop. In that case, it's not a extremely expensive device, when you are considering taking MC exam, right? Yeah. So, make sure that, sorry. Yeah. Call is coming from headquarter, my wife. So let me turn off that one. All right. Just give me a second. Okay, so here's the thing. So use mobile phone for class is not a good idea. All right. So make sure you use a laptop device, even not a tab. Same thing again. I mean, they don't have good file. They don't have a good, I mean, some will come with iPad. Wow, I also do have an iPod. It's never the same thing. A laptop versus iPad. Otherwise, even in Australian system, they would have used iPad. They also use laptop or desktop, by the way. Otherwise they would have been used iPad. iPad is sometimes okay for those are small kids and the thing, just to watch video like YouTube video, things like that. And they are very smart, let me tell you. Actually, these kids, because from the beginning they have been trained with iPad. Okay, so that is a very different thing. Those have been trained with iPad from the very beginning, they perform very well. Okay, but if you are new to iPad, don't think that you are the extreme expert. Okay, so this is a few techniques I'm telling. If anyone is hurt, please don't mind, but I'm telling for your betterment. It's okay to be, I'll be the villain, but you'll be the hero at the end of the day. But I'm okay with that one. All right, so next is coming some do's. Attend live classes. I always have my blessing for all those doctors. They keep attending my live classes. Okay, so I have always the sympathy for them. I usually don't get angry on the things unless someone told, doctor, I missed the class. My mood swings, terribly. When that message, especially in the other days, it comes to my messenger. First of all, you should try restricting this kind of message. I'm a tutor of so many people, but as a genuine tutor, I don't like missing classes. In spite, I also upload the recording. You still miss that one. Now you should have a shame before sending me a messenger text. Now, wonderful still, doctor, we are not teenager. That's okay. But for me, when you are taking admission, I'll be your tutor, you'll be my student actually. And when someone message text, I don't see the ages always, right? Because there's so many 5,000-6,000 students, it's tough to see ages before texting. Okay, so I don't tell in that way. I judge you just as a student, as like other so many MBBS, BDS, even post-graduation students I have. So you have to respect me. I also give you respect, but every tutor who is a genuine tutor never likes these things missing their classes actually. Yes, 1-2 occasion that can be, but that's the reason we give the recording, right? So that the next day you can see it. Is it fair enough, guys? I mean, I hope so you don't mind, but the things I'm telling, these are very fair enough things which I'm telling right now actually. If you miss on Sunday, it can happen. You miss on the Sunday, then just take it on the Monday actually. Monday you can take it, Even Tuesday morning, it's also available. You can also still take it. I mean, the recording, right? So you have a total 24-hour time to again retake it actually. In spite of then still you are not there, that means you better not to come to your tutor in that case. That time I will not be responsive with any kind of thing. Nowadays, I told Mr. Khaled, if any, because my messenger also managed by Khaled, is one of my close friend and also general manager. If any message comes with recording, you just skip it from my, you know, viewing actually, because it hampers my mood all the time actually. Yes. No, it's not possible actually. Can you leave the recording little longer? 24 hour is much longer time. Previously, there was no recording is to be given. Okay. 24-hour is huge time. It's not possible for more than that. And if you have more problem, you can switch to course D. Now we have a more suggestion for them. Still, you are working in a ER emergency department. You have a very high profile job. I highly recommend, we have the system of taking course D. Course D, you can always, whenever you want, you can take the classes actually. That's up to you. So we have the system. You need to understand these batches are for which type category of doctors. Those can attend classes regularly. Okay, so you need to understand which students I'm taking in these classes. Those actually manage classes. So still you have problem, you can call us on the Friday, doctor, please switch me from the live batch to your course team. We'll do that in that case. Is it clear, my dear doctors? I think what I'm saying is fair enough. I don't see many messages, so I think doctors are opposing actually. Like with my, whatever the things I'm saying, I think they disagreed whatever I said so far actually. So it's okay actually, you know. Teachers are always villain, they're never the hero actually. Yeah, especially these online media things actually, is actually tutors are mostly villain. I'm doing a lot of research. So those are the successful online tutors we have. They also said, yeah, it's not, we don't have that kind of calm experience when it's in online. Actually, everyone can say anything actually, but if it's a live class, your students will give you ultimate respect. We all, the experienced online tutors agreed on that one, that the students don't give that kind of respect to the tutors, especially if it's like face to face actually. But it doesn't mean the online tutors give less actually effort and the things actually. All right, and now we can see even like, I mean, there's 80 attending classes and just 2 or 3 are responding here, so you can understand they don't bother actually what the tutor is saying. They're just here for to take class actually. Some telling and messaging their friend, this teacher is telling bullshit right now, but that's okay. Okay, so thing is, attend live classes, self-study, study groups. I mean, very, very important. Now, the next important point that is coming, study groups. You need to definitely follow guideline group very well and MedX group very well. Actually, in past, many doctors did that. Okay, so I mean, so study group should be there and using the big forum actually. Okay, so that's the thing. And make sure you study 5 hours a day. So 5 hours a day, 5 days a week for 5 months. You need to take it actually. Okay, and take exam date as soon as possible. I mean, when the course will be in the middle part, so example, when we'll be getting into the surgery, when we'll be finishing the surgery, you should start taking exam date. What you should do now, you should finish your epic verification. Now another doctor previously called and she wants to renew. Okay, so when I was talking to her, I figured out epic verification even not done. Now that's very sad that one batch you hold finished and you don't get time to finish your epic verification. Now you should definitely finish your epic verification. I mean, this is the right time to finish the epic verification so that you can take the exam date. You should take the exam date later actually. So please start with your epic verification first, then plan a date, and your date should be, for all those dear doctors in this batch, should be October or the November actually. So that's all from, I mean, today, just for as the advice part actually. So sorry about bothering.